Tell me if you've ever had an experience like this. You can share in the comments below, it's okay. You go to the pharmacy or to your physician's office and you have your blood pressure taken. Now we know in the pharmacy you've got those manual ones where you put your arm in and it cuffs up and it gets really, really strong and tight. Feels like your arm's about to fall off. And at the doctor's office, they do the automatic blood pressure cuff as well. They wrap you up and we let it just run. And it always seems to go too high. And then you get your reading back and you're like, oh my God, what just happened? Why is my blood pressure so high and should I be worried? I mean, I feel fine. There's nothing wrong with me. So we're going to dive into high blood pressure today, also known as hypertension, right after this. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. In today's video, we're going to talk about a few different things. First of all, we're going to define what high blood pressure is. We're going to look at the differences between Canada, the States, and the European countries, because if you're a nurse watching this video, you're going to want to know these things. And we're also going to look at some of the signs and symptoms, the risk factors, and then the 4 steps to managing hypertension. So we've got a lot to cover. Now stick through to the end, because I also have an analogy to help you explain blood pressure to your patients and an NCLEX question. Now before we can talk about what a hypertensive reading is, let's take a quick step back and look at the normal values. So systolic is the value that we use to describe the most pressure in your vessel. So that's when the heart contracts. And diastolic is the term we use to describe the pressure in your vessel when it is at rest. So 120/80 or less would be considered healthy and normal, no concern. With one caveat, obviously you can get too low and that's hypotension, completely different topic. So generally speaking, a normal blood pressure is less than 120/80 and not so low that it's causing you symptoms, which would then be classified as hypotension. I've often seen people sitting in the 90s to 120 as normal, and then the diastolic can be less than 80. In Canada, and it's important that I talk about Canada versus the States and the European countries because there are some differences. In Canada, when you have a reading that is over, or actually greater than or equal to 135/80, and we have multiple readings that average out to being more than 135/80, so you can have 2 or 3 readings done at the same time or over subsequent visits, then we would classify this as hypertension. Now again, there's a caveat, because if you do have some health history such as diabetes, we're going to back that down to 130/80. Anything greater or equal to 130/80 would be diagnostic of hypertension. Now, of course, it can't just be this easy, can it? No, because there are some different things we need to consider. If you're using an automated office-based visit, so you're doing the cuff at the doctor's office, or you're doing the cuff at the pharmacy, we know that research shows us the blood pressure cuff in places like pharmacies and public places tends to read higher. So what's more important is that you're getting an average and you're documenting all of those different readings. And then when you bring that information into your doctor's office, they can do their own assessment. Now, if we're doing a manual cuff pressure, so this is where we're actually pumping it up and we're listening with our ears, those values will shift a little bit higher depending on where you live. But in general, these are the numbers that you'll need to know. 120/80, the range goes up to 135 if you're in Canada, 130 if you have diabetes, and you'll see here in a second, I'm going to show you the differences with the other countries, that 130/80 is the standard for a few other places that we need to be watching for. Now let's go to the Hypertension.ca website. This is our Canadian guidelines, and I want to show the algorithm here. If you've done a blood pressure at home, in the pharmacy, or maybe you've had a blood pressure clinic at work, and your reading is greater than 130/80, we'll want you to come in for a dedicated office visit. Now when you come in, if your blood pressure is greater than or equal to 180 systolic over 110 diastolic, that is a diagnosis of hypertension. If your reading is less than that, and you do not have a pre-existing condition of diabetes, and we are using an automated office blood pressure cuff, we'll be looking for readings to be less than 135/85. If you happen to have a reading that is greater than 135/85 on this visit, we will then look at implementing some out-of-office measurements, such as you'll be completing tracking of your blood pressure at home. If your at-home readings continue to be elevated over 135/85, we would consider that to be hypertension. If they resume to levels below that, we would consider this to be Whitecoat hypertension. Now, if you're using a non-automated cuff, so this is the manual cuff, and your readings are greater than 140/90, we do give a little bit of a leeway there. Then we're going to continue on with the same out-of-office measurements. If with either method, your blood pressure remains less than that when you come in, there's no diagnosis of hypertension. Now, here's the caveat we want to talk about is diabetes. We like to have your blood pressure less than 130/80, regardless of which method we are using. If when you come into the office your blood pressure is elevated over 130/80, that would be a diagnosis of hypertension. Now, let's take a look at the American and the European guidelines. This is coming from the Journal of the American College of Cardiology. This is from 2019, and I want to highlight this table here. We'll see here that the office/clinic blood pressure in the American College of Cardiology, they're looking for values of greater than or equal to 130/80. The European Society has a little bit more of a range there, and they're looking for greater than 140/90. Let's take a look next at staging blood pressure. Starting with normal blood pressure, we're looking for values of less than 120/80. Pre-hypertension or elevated blood pressure is 120/129 over less than 80. Stage 1 is 130/139 systolic over 80/89 diastolic. And stage 2 hypertension is greater than or equal to 140/90.
All right, so the next thing I want you to understand is that there's two different names we use to describe hypertension. So we have our staging, but then we also have a name to describe the cause. So what can cause high blood pressure? The first term you may hear is that you have essential hypertension. And essentially what that means is we don't know what's causing it. It's of an unknown origin. And you'll often have this diagnosed after they've done some testing. 90% of high blood pressure is considered essential, according to the research. The second type is called secondary, which means you've already had a pre-existing condition, illness, disease process that is resulting in high blood pressure. Now, the third type of high blood pressure you may have is known as white coat hypertension. That essentially means that when you come into the physician's office and you see the doctor and you're sitting there waiting, just the presence of the medical team, the white coat we call it, will cause you to become tense and your blood pressure will elevate. Hypertension is known as the silent killer. And that's because when we're looking at signs and symptoms to help us define and diagnose an illness, high blood pressure often comes without any signs or symptoms. So it's really important then that we talk about the risk factors so that you know if you need to be monitored more closely for the potential of high blood pressure. So we look at some of those risk factors that you may want to be aware of to determine if you're at higher risk for hypertension. We have what's known as non-modifiable, those things we cannot control, and then modifiable. We're going to first talk about those that we cannot control. So our non-modifiable risk factors include our age. Look, as much as we want to be younger, physiologically, biologically, it's just not going to happen. So your age is a factor. Family history and ethnicity. Now, in terms of those things that we have some control over, that we can influence the trajectory of our cardiovascular health, the list is a little longer. So diet, so if we're eating unhealthy foods, higher risk. Change that over to healthy foods, lower the risk. Exercise, stress, weight, we're looking at smoking and alcohol use, we're looking at our sleep patterns, other things such as kidney disease, where we have had an opportunity to prevent the onset, those are known as modifiable risk factors and will definitely impact the longevity and the health of your cardiovascular system. Next, I want to talk about what happens when you have hypertension. What are the risks to you? One of the things that happens when our pressure is high, this is like pushing a ton of fluid in a small straw kind of thing, is that the vessels become damaged. They get so stretched and so worn that they get thin and the wall starts to become, there are tears in the wall. So those tears set off a response in the body to repair it. And what ends up happening is we can end up having plaque development, which is what's known as atherosclerosis. So as a result of having high blood pressure, we now have buildup inside the arteries. This will decrease the ability of those vessel walls to stretch and recoil. So we lose some of that flexibility, which will increase the peripheral vascular resistance. Now, when you have to push harder to get the fluid through the same hole, what happens is then the heart size has to increase because now the heart is working harder. So we get hypertrophy, which is now leading into further cardiovascular concern. We now have increased oxygen demand. Our heart is getting larger, it's working harder, we're going to get tired faster, and we potentially can rupture or remove. The pressure might lift off that plaque and it gets dislodged, and it can settle in the smaller vessels in the brain, so a stroke, in the heart, a cardiac arrest, and we can also end up having damage to the smaller vessels as well. You may also know somebody who has high blood pressure and they complain of vision troubles. That's because it's not just the bigger arteries that we're worried about, it's the smaller arteries that we also have to be worried about. They can get damaged easily as well. The eyes, the kidneys, the brain, all really important pieces of our body that are at high risk of insult and injury if we're not taking care of our blood pressure. So now you may be wondering, okay, so I've had high blood pressure for a while and so is my neighbor, but he seems to be fine with diet and I have to take 2 different pills. Why is that? Well, there are 4 different stages to treating high blood pressure, and we often will start with lifestyle changes. Remember those modifiable things? Diet, exercise, stress, sleep. We'll look to see if we can correct those because the goal of therapy is to restore our blood pressure down to baseline and normal levels. If we can do that without adding on medications, we're going to start with that. So in treating high blood pressure, there's 4 steps, we call them, and we always want to start lowest and build our way up. Now, in previous videos, we've talked about many different factors that affect our blood pressure, which means there's a lot of potential in treating it. We always start with lifestyle changes. We want to see if we can modify and reduce your blood pressure back down to normal levels without the need for additional medications. One of the primary reasons that is our targeted treatment of choice is we know a lot of patients struggle with the side effects of taking an antihypertensive drug because previous to taking the medication, they had no symptoms. Remember, this is the silent killer. Many people have 0 symptoms, and now all of a sudden when they take a medication, they're having side effects, and that makes compliance a little harder. So lifestyle is number 1. If we can't get sufficient changes with lifestyle modifications, we are going to add a drug. Notice I said add. We're not going to abandon lifestyle changes. We're going to ramp up our approach. So we're adding a drug. This may be a diuretic, so potentially you've heard of something like Lasix. And there's other drugs that can be used, drug classifications, that can be selected here. If after this period of time, the lifestyle changes plus the drug are not getting the results we want, we have 2 options for stage 3. We can either change our initial drug choice to another classification and see how that works, or we keep this drug and we add a second. Remember, this is an additive step process. Now I have lifestyle plus 1 drug plus a second drug. Different classifications because they work differently. And then as you guessed it, if stage 3 we're not getting success, we're going to add another drug in stage 4. So potentially you will have many patients with hypertension, all being treated across that spectrum with different strategies. One patient may be salt restrictions with a diuretic. Another patient may be they don't really focus on diet because that never worked with them, but we're looking at stress reduction, we have a diuretic, and we have an ACE inhibitor. Because we need to attack that blood pressure process at many different points to achieve our ultimate goal of lowering blood pressure to a safe level. So now it's time for an analogy. How do I help my patient understand just what hypertension is? Especially when we can't see it and we can't feel it. Well, I've got a visual and a tactile example for you. There's actually two. The first one is the water in the tap. If you turn the water on gently, they can see that there's a regular stream of flow coming through the tap. If you turn it all the way on and the volume and the noise increases, that would represent the blood pressure increasing in your stream. The second analogy is to use the example of an air mattress. And when you pump it up, it gets harder and harder and harder. But there's a moment where it's comfortable and then it's uncomfortable. So when you're pumping up your air mattress and you've reached that perfect place, that's where you want your blood pressure to be. If you put just a little bit more air in, it's a little firm, but it's manageable. That would be stage 1 hypertension. And if you pump it up too high, it's really firm. That kind of represents the vessels not having any stretch and recoil left in them. So our vessels are really wide and they're at risk of getting damaged. That would be stage 2. Now it's time for your NCLEX question.
Okay, so you've completed a blood pressure screening for an adult patient today, and these are the results. How do you interpret this information? Go ahead and pause and come back when you're ready. Okay, so you're back. If you identified prehypertension, you would be correct. Okay, let's try one more. Your patient is at the office for follow-up. On his last visit, a diuretic was added to his treatment plan for hypertension. Today, his blood pressure is 148/92. What do you anticipate will be the next step in his treatment plan? You will select all that apply. Will it be A, add lifestyle changes such as diet and exercise? B, increase the dose of his diuretic? C, consider a change in the drug therapy, so stop the diuretic and start an ACE inhibitor? Or D, add another drug to his treatment plan? Go ahead and pause here and come back when you're ready. Okay, so did you answer add lifestyle changes such as diet and exercise? If you did, that's one of the most commonly picked answers, but it's not correct because remember, this is an additive process and the lifestyle changes would have been put in step 1. So we're currently entering into step 3. So we will either increase the dose, change the drug, or add another drug to his treatment plan.
Thanks for watching. We're going to be talking about the different medications to help treat hypertension in subsequent videos, so be sure to subscribe and hit the bell so that you get notified when those videos are released. In the comment section below, share your own journey and the things that are working for you and are not working for you. I think when we do share that, people can see that 1, they're not alone, 2, it's not always easy, and 3, that there's multiple ways to help patients navigate their blood pressure. Thanks for watching, and until next time, make it a great day.